Good evening. Patient safety is under the microscope again tonight with new allegations that BC has hired a number of medical professionals who are unqualified. As we reported last night, a growing shortage of anesthesiologists has been causing major surgery delays at hospitals around the province. And at one of those hospitals in Cranbrook, a department head has resigned. She is claiming that East Kootenay Hospital is so desperate to find anesthesiologists that the hospital went around her to bring in a doctor who is not yet fully licensed. And tonight there are claims that the Cranbrook case is far from unique.
Finding a qualified anesthesiologist these days is so difficult, some hospitals appear to be skirting the rules. In Cranbrook, the head of the anesthesiology department resigned 2 weeks ago because she felt the hospital had usurped her powers to recruit new doctors. But going around the department head is only one way to get doctors working here. Since 2001, the province has been bringing in foreign doctors, even though they're not qualified to work as anesthesiologists here. They're given provisional licenses until they pass their Canadian exams.
In the last decade, we've had 64 people come in who are non-certified to practice in BC, out of a total number of us of 350. So that's one of the concerns, is that we need to ask ourselves, why are we needing so many people who are non-certified?
Foreign doctors get a chance once a year to write their certification exams, to a maximum of 3 tries. So in 2008, the province brought in 17 unqualified anesthesiologists, giving them provisional licenses. 3 years later, only 6 of them had passed the test. Of the 11 who failed repeatedly, 2 left the country, but the other 9 are still practicing. And at least one of them failed the test a 4th time.
If you're not able to pass your exam, after 4 tries, there's a real problem there. And quite frankly, I'd have to ask the question, as I think most members of the public would ask the question, why are you practicing? And, even with supervision, I'm not sure that I would want you operating on me.
But the College of Physicians and Surgeons, who hands out these provisional licenses, say the accreditation exam is far from everything. In fact, there are new ways being developed to make it easier to assess qualifications.
Certainly, the college has in the past been criticized at setting the credential levels too high for people to get licensure, and an expectation that there are some people who are better assessed in an in-practice setting as opposed to a paper and pencil examination might be a better way to assess them for their competence. So we're pleased that the Royal College has developed a new alternative route to being certified, but rest assured, people are competent when they're given a license by us.
You're an airline pilot and you fail your pilot's exam, you're not allowed to continue flying. If you're a cab driver and you fail your driver's license, you're not allowed to continue driving. And so the question is, how is it that we have people who are failing their exam multiple times and they're continuing to put patients under anesthetic and provide really life-saving surgery in less than optimal circumstances?